Considering the possibility of importation of the coronavirus to Nigeria, the Federal Ministry of Health is working with relevant ministries and agencies to strengthen surveillance, preparedness, and response to public health emergencies at our various points of entry. Bearing in mind that air travelers, rather than land border crossers, are more likely carriers of this type of virus, attention will focus largely on our 5 international airports. The Port Health Services of the Federal Ministry of Health is the responsible public health authority at international points of entry, which are airports, seaports, and land borders. And Port Health Service is currently implementing measures at these points to forestall importation of the coronavirus to Nigeria. This briefing is necessary, first as an advisory to the population, and secondly, to be able to counter a lot of disinformation and misinformation circulating in social media and also in other forms of conversations and reports.
Welcome back. Well, yes, indeed, we're keeping up with that. And we've got Dr. Ganiu Jamiu here with us. He is a member of the Association of Public Health Physicians of Nigeria, Lagos branch. He's also a senior registrar at the Department of Community Health, Lagos University Teaching Hospital. Thank you for coming on this morning.
Thank you very much.
So I just heard the minister in that briefing yesterday while he was highlighting the efforts, the measures, plans that they put in place to ensure that public health is not put in jeopardy as a result of this this virus of global proportion. What do you think of this strategy, this plan that he's put in place? At least, how much can this achieve?
Actually, in any response in the country, ideally you are supposed to have a coordinating unit, which is being chaired by the Honorable Minister of Health. And ideally, we have structure on ground already. Apart from the Port Health Services that are working in the airports, we also have the Nigerian Center for Disease Control. They are actually chairing the issue of disease response in the country. So actually, the whole of response has to do with is a stakeholder, a multidisciplinary approach. The Port Health people are just representing that other people. We have even the Federal Airport Authority. All of them are working in conjunction to see that they actually strengthen surveillance. But my worry is that even before the surveillance, we need to have a plan, a contingency plan, because the issue of response go beyond just surveillance. We need, the manpower is there. This is a new disease that is just coming on board. We need to train people about it. It's a new thing entirely. It's not like the other, like Ebola, that we are all accountable.
You haven't seen that happen yet?
It's a new virus entirely.
So, but the training is not happening
yet? It's not, I've not heard about that. We need, let me just, we need training. Then we need to get fund to procure some of this thing, because issue of infection prevention and control is very, very key. Because even what is currently happening in China now, you find that some of the health workers are even getting infected, because there are a lot of mystery that is yet to be unraveled about this coronavirus. Even WHO, they are working around the clock to see that they get, in some quarter, they will tell you that is contacted from snake. Some people say it's contacted, different kind of, so they are yet to actually know the actual means of, transmission of this. Even of late, they will tell us that we should cover our mouth or avoid sneezing in public or coughing in the public. But recently in China, despite the use of masks by the health workers, so there is ongoing speculation that the virus can be transmitted through the mucous membrane of the eyes. So it's really a big of challenge. The current thing, currently now, that's the current standard operating procedure that WHO is currently using is an adaptation from what was used to actually respond to SARS, Middle East respiratory syndrome, in which the common thing we need to do is that firstly we need to, apart from the general press briefing, we need to educate the people, the general population, and that has to do with working with the media, with the newspaper houses, to see that we translate some of this into different major, let people be sensitized that there is an ongoing, infection.
If I get your point,
yes,
you're suggesting that, assuming the Port Health Service officials pick up a signal of somebody who has it and he's quarantined, if they take him somewhere or bring him to a health facility there, we don't know how to contain that.
Very good. So that's another aspect I want to emphasize, that, okay, in all these 5 centers where there are international airports, have they identified the isolation center? Have the people that will manage these cases, are they being trained? Are they being identified? Even let's say we want to do contact tracing, where are the people, the foot soldiers? Are they being recruited? And let them be on the standby. But even when you have foot soldiers, have they been trained about this, aware of the mode of transmission? Are we going to respond when it comes? So we see whether we've been trained before. We still need to continue retrain ourselves to abreast ourselves with the current information, because this is a new virus entirely.
On the one hand, there are some information out there.
Yes.
And just as you have alluded to, it doesn't seem, smooth enough for people to really consume.
Yes.
So there is the fear of panic.
Yes.
How do we allay people of that fear? Because one of the things we hear of this coronavirus is you could even have it and not know. So take us through, what are the things to look out for? How will even the health workers themselves know, since the symptoms don't show until it's gotten worse?
No, actually, because it simulates, if this is not the only first coronavirus we have. We have coronavirus that can cause common cold. We have them in the past. And we have, the symptoms normally present just like a normal severe respiratory infection. So currently, WHO has been able to develop a case definition. And I think that will guide even if we are trying to screen. I will tell us through the process. But one of the cases is that anybody that presents with fever and cough, and that cough can warrant hospitalization within the period of 10 days, is one of the case definition. Then another point is that anybody that is presenting with fever, cough, and after 14 days of visiting Wuhan, where that the virus was discovered, or has worked there, can also be a suspect. Then another case definition, as contained in the case definition, is that any health worker that have close contact with any of those people that have, of any of the suspect or confirmed case, is also considered to somebody that can be a suspect. For me, I feel for now, to allay the fear, as I said, the common thing is approach for generally all coronaviruses is that for the public, anywhere you see anybody that is coughing, if somebody wants having cough or want to sneeze in the public, if you don't have a handkerchief or you don't have tissue, you can just flex the elbow and cough or sneeze. Then if you have tissue, you can use tissue to cover the mouth and when sneezing or coughing. Then after which you discard, then you try to wash. My general advice to people is that we should all be carrying hand sanitizers, because that's what it is recommended. Then we need to pass a message to the general public that should, in case any of these people that are coming from China, Asia, any one of the others another, we need to get their contact. We're even suggesting that, especially in the association, that if you can get the manifesto of all those people coming, so that we get their contact. Like US, what they are doing currently in US is that all those people that are coming, they quarantine them. Not that in quarantine them, not that they put them in a specific place. You can do self-quarantine. You will not leave your house. You just be in your house for the period about 14 days, which is so, and they keep on communicating with such person until the period elapsed. If we can, then one thing US they do is that they try to compensate such people by giving, people need to go to work and so on. So I think that if we can adapt such kind of approach, it will go a long way. But as for what I just said, we can also, at the airport, apart from the airport, we need to disseminate information in such a way that anybody that has certain symptoms and he or she has traveled to such area, the area where there's currently an outbreak, they should alert. There should be a special number where they will call so that they can be assisted by a health worker. Then at the airport currently, I don't know what is going on currently, but usually we do what we call screening. And in the literature which I just checked today, the fever is one of, as I mentioned earlier, but at times there may not be fever. Right. So the issue of using infrared thermometer is scale through. Okay. So that's the challenge there. What I want to say is that we should have, as health workers, we should have high index of suspicions. The another thing is that we should use a checklist. Just like what we did during Ebola. I participated in Ebola that time, where we have asked some questions.
Yes. You've mentioned some of the things. It appears as though you have a group of medical practitioners where
yes.
you perhaps, message yourselves
yes.
and send advisories around. And
yes.
you talked about manpower. So the question is, yes, there's a coordinating, center, yes. the Ministry of Health, the NCDC, yes. but then it seems we have another group of medical practitioners. So how well are you working together with that coordinating center?
No, we are really working together. Like, as I said, you see, we have the structure on ground already. And this structure is called Emergencies Disease Response and Preparedness. We have it at the national, we have it at the state, we have it at the local government, we have it in our hospitals. Usually, for God forbid, if something should happen in Lagos now, we all collaborate together. It's a collaborative thing, not that it's a standalone. Even the coordinating units at the Abuja there, it's a collection. Even the law enforcement agencies are also involved. So it's a multidisciplinary approach.
Well, when you mention some of the lapses you have seen, some of the areas we need to cover, it begs the question, how well are you, advising them? How well are you saying, we think we need to tweak these areas? And what's the response you're getting?
Yes, that's what I'm saying. My advice is that I don't know whether there is a plan. Usually there's generally a plan for every disease, but this is a novel virus. So
what makes it novel, really?
Because this is the first time. It's a new strain of coronavirus. We'll be having other types. That, as I've mentioned, the one that caused common cold, the SARS in 2002, 2003, the Middle East Respiratory Syndrome, which was, it was around the Asian, Mediterranean area, Saudi Arabia, and so on. And it was, the source of that infection was through the camel. But this one, they are yet to know the source. But the only thing is that because of the symptom resembling normal severe respiratory infection, that is why they now use the experience of SARS and see how they can work around. But my fear again, I just remember one point, is that in case we have a suspect with actual severe respiratory symptoms, what are we going to do? Because these kind of people, you cannot intubate them. You cannot say you want to manipulate to aid their breathing. Because by doing that, you are transmitting more of aerosol. That's why they have a different device in China, how they ensure that they have them with, like a pipe where they breathe. For God forbid, how are we going to manage that? They cannot be subject to mechanical ventilation. Based on that, you don't try any position, especially those ones with severe respiratory distress. If not, you'll be adding more to their problem and you'll be transmitting more. So these are some of the contingencies of plan, getting all those things on ground. No. And who will manage them? Have they been trained?
And part of those who will manage it, for instance, the port health services. Do they speak Mandarin?
No, the port health services. Okay. These are...
You have to ask questions.
Yes. But let me tell you, like in port health services, what they do is they are doing their job, they are well trained. But my concern, I don't even know, because one another aspect of this virus as released by WHO is that the screening place should be well ventilated. So I don't know, it has to be properly ventilated. And one thing is that for health workers, because currently many health workers are now susceptible to this, they must apply the principle of universal precaution, or we call it standard precaution. That is, you assume that every patient with cough, fever is a suspect until proven otherwise. That's what
Even
we
though
do.
you say they can escape the radar.
Yes.
Without, some of them may not even have fever.
A fever at all. They may
What
not
do
even-
we do about, because I mean, some of what people saw is that they were eating all sorts of things. And
yes.
of course, we know we have a lot of Chinese restaurants in these cases. We don't know what point. How should we approach that?
Mike, you see, as I've said, currently, they are yet to pinpoint which of the source that virus came on. Some people say snake, but generally, the current virus is more of a zoonosis. What do you mean by zoonosis? All those infections that can be, animal that can be transmitted by no one. Just like SARS was gotten through bats, the other ones through camel. So, like for this one, I don't think we should have any concern with Chinese restaurants because generally there, in that market there we are, you see all sort of wild animal, koala, you see all sort of. But I don't think we have such kind of marketing. But we still have other rodents and whatever. But I think the only way, as I've said, or what the Honorable Minister of Health said is that we should maintain highest level of surveillance.
Do you think this is a global epidemic yet? Because I think the WHO is trying to be careful in its approach to this. But from what you have seen, over 1,000 confirmed cases,
yes.
over 100 deaths. Do you think it's a global epidemic?
Based on available information as at yesterday, it's like there is pressure on WHO to declare it as a global emergency, but they are yet to. And that, by not declaring it, is also making some countries to be a bit relaxed with their surveillance. Because by declaring, you make everybody to wake up, funding allocation, training will commence, resources will be, will be available. But by not making it, so it's making some people to be a bit relaxed. My concern is that Nigeria, I'm sorry, I don't want to use the word dumping ground. Everybody, China, many Nigeria go and, run their business in China and so on. So we really need to be on top of this if we want to actually prevent this virus coming into the country.
All right, fine place to let it go. Dr. Ganiyu Jamiu is a member of the Association of Public Health Physicians of Nigeria, Lagos University Teaching Hospital, Lagos branch, but the senior registrar at the Department of Community Health with Luth. Thank you for coming.
Thank you
all
very
the best.
much. Thank you.
We're back in a moment. Stay with us.